Today on Keynote.
I have no doubt that one day we will look back to think about how primitive were we when we were prescribing drugs and therapies for people without really knowing what constituted their DNA makeups.
My name is Bill Russell. I'm a former CIO for a 16-hospital system and creator of This Week Health, where we are dedicated to transforming healthcare one connection at a time. Our Keynote show is designed to share conference-level value with you every week. Now, let's jump right into the episode.
Hello, I'm Sue Schade, principal at StarBridge Advisors and one of the hosts for the Town Hall show here on This Week Health. But today, instead of a town hall, I'm doing a keynote interview, and it's with Albert Oriol, the VP for Information Management and CIO at Rady Children's Hospital and Health Center. I've gotten to know Albert over the last couple of years at Chime and other meetings, so I'm really looking forward to having this conversation today. Welcome.
Thank you for having me, Sue. Excited to be meeting with you this week.
Yeah, and we'll have plenty to get into here. Let's start by having you describe Rady Children's for our listeners.
Sure. So Rady Children's is both the provider of choice and the safety net provider of pediatric services in San Diego, Imperial, and Southern Riverside counties. We're the largest pediatric hospital on the West Coast. And with the upcoming merger with Children's Hospital of Orange County, we will soon be most likely the largest pediatric hospital in the nation. We're a top 10 pediatric hospital in the best city in the U.S. If you ask me, I'm biased, I know, with 6-time recipients of the EPICS honor roll and known nationally and internationally for innovation and excellence in care.
Excellent. And you said it's the best city. And I already commented as we were getting started that you have a vest on. You said it's how cold there?
Yeah, it was chilly this morning. It was in the 50s, which we're not used to here in San Diego.
I get it. And here I am in Massachusetts, and it's like 20 something with a wind chill that makes it feel a little cooler. It's all relative. What we get used to. Let's start maybe broadly talking about children's hospitals and the challenges that you all face today. What are some of those key challenges and how do you see technology playing a role in addressing them?
There's definitely no shortage of them. Probably the biggest challenge, I don't know that this is unique to pediatrics, but it's exacerbated in pediatrics. It's around reimbursement. Of course, 50% of our patient base is covered through Medi-Cal, which is California's Medicaid, and the rates are just atrocious. So that reimbursement pressure is tremendous, and that means we got to be innovative and creative on how we meet the needs of our patient population at a lower cost, right? Like other non-pediatric organizations, we also have seen over the last few years an increase in clinician burnout, both nurses and physicians. And frankly, it's not unique to them. Other administrative professions are also seeing that burden that the prevailing reimbursement rules impose on our workforce. We're dealing with that. We're dealing with the aging of the workforce, in particular on the clinical space and the shortages that creates across many disciplines. And we've seen that now combined with some pervasive supply chain shortages that have added additional challenges for us, which both drive resource scarcity and escalating costs. Cybersecurity, of course, is another big risk, not unique to pediatrics, but there used to be a time when it seemed that pediatrics were off the target list, but as we've seen in recent years, that's no longer the case. And so that's something that we take very seriously. So I would say, you asked me what role does technology play on that? And my take, for many years, I adopted this motto of better care through health IT. And that is not just in the clinical space, but on everything, all support functions. And my sense is that both cyber is obviously centered on our world of IT. I see RPA and artificial intelligence or augmented intelligence as critical tools now and in the future to help us address some of those challenges, to function more efficiently, to take burden out of clinicians who should then be able to focus on more clinical value-added tasks, to be able to target with personalized medicine more effective therapies and treatments, therefore reducing costs that don't add benefit per se. We ultimately anticipate that we're going to be able to improve productivity and even extend people's careers because that cognitive and administrative burden that leads to burnout and early exits will be diminished.
One of the questions I wanted to ask you about is precision medicine. You just referred to it. I think you said personalized medicine. It's obviously a promising area in pediatric care. How are you working with IT and the infrastructures to support the needs of personalized treatment?
One of the big areas that we've invested heavily in and we have a big focus on is genomics. We established a genomics institute in 2014, and I don't think it gets much more personal when it comes down to precision medicine. So I could talk about that for hours on end, but what I would say is that through genomic medicine, this is frontier medicine, and we are really changing the way that care will be provided in pediatric institutions and hopefully beyond. I have no doubt that one day we will look back to think about how primitive were we when we were prescribing drugs and therapies for people without really knowing what constituted their DNA makeup. Now, for many years, we've used augmented intelligence to help our genomic clinicians come to a diagnosis for rare disease, right? Probably the thing that excites me the most today on the space of genomics is our Beginnings initiative. We've been leading a consortium of providers, pharma, tech companies, associations that is committed to modernize the newborn screening process and take what today is a process that screens from anywhere from 30 to 60 or so conditions to something that screens for hundreds, if not thousands, of conditions with known treatment. And our Genomics Institute folks have been pushing the envelope there, and combined with a tool that we call GTRX, which is an expertly curated database, which today has over 400 known treatable conditions, but we're anticipating we will expand to over 1,000 here in the next not too distant future. We hope that that database will be key because it will provide real-time decision support for those clinicians receiving these rare diagnoses that they may have not ever seen before. And that is something that is exciting to me, but it's not the only area where we do personalized medicine. We do personalized medicine when it comes down to surgery. We have a very advanced 3D imaging lab that basically has allowed us to plan individual surgeries with a level of precision and detail to the individual patient to reduce the amount of improvisation needed after the incision is made. And that's something that has been key in a number of our surgical specialties, our Heart Institute, our orthopedics, neuro brain institute, you name it. So that's also been amazing. And of course, with all the new drugs that have appeared in the last few years, right? The $1 million drugs with CAR T treatments and in gene therapies, etc. Those are very expensive, require great synchronicity between kind of the patient's data and the drug manufacturers. And so that also involves a lot of data sharing and technology along the way. So there's no shortage. I could go on and on for hours on personalized medicine efforts here, but needless to say, in the 21st century, it's all stuff that can't be done without the digital world.
Wow, fascinating. Thank you for explaining all that. So you mentioned at the beginning, the beginnings, no pun intended there,
No pun
but yeah, the Beginnings Initiative, and you talked about other organizations that you partner with. Can you go into that a little bit more and how those partnerships are working, what role you and the IT team play with that?
It's a team effort, and really it's all led from the operations side. Our champions in the Genomics Institute lead that effort. We provide a supportive role from an infrastructure standpoint, right? We're organized in a way where we provide corporate services for all the infrastructure, all the integration. We we have all kinds of platform engineers and clinical informaticists and integration engineers and data analysts and data scientists and bioinformaticists and you name it, working in collaboration from central IT as well as the clinical folks on the Genomics Institute to develop, build, support the technology. When it comes down to other entities, we basically develop a way to ingest. Over the years, we've become a reference lab for, I think we're at about 100 institutions now where we do their rapid whole genome sequencing. And so to run the genomic sequencing, and then we bring those two sets of data together along with a number of third-party available dictionaries out there to be able to deliver that end result. There are other folks that do things similar, maybe not at our scale, but great minds, joint efforts, and decided that, listen, we have a tremendous amount of untapped impact, right? When you think that every time a baby is born, we only test for a minimal amount of genetic conditions, and that there are many others that are treatable. And if you catch them early on, those babies are going to live up to have unencumbered lives. And if you miss them, then the impacts and the sequelae are going to be impactful and in some cases really devastating to those kids and those families. And so we think that is unconscionable, and we have the information and the technology to make a difference. We can't boil the ocean, but we can certainly make it much better than what it is today. And so I think there are enough folks in that space that align with that optimistic view of the future. And if you want to see a different future, you can't just wait for it. You got to make it. And we're making it. We're very fortunate that we partner with companies like Illumina and other technology companies, with pharma companies that help to fund the efforts required to bring this consortium together. But again, I think it's going to be the future. And when we look back 10 years, we'll think about how come we haven't been doing this sooner, right?
Right. And are you unique as a children's hospital in these initiatives? You talked about being the largest children's hospital on the West Coast, and that when you merge with Children's of Orange County, you may be the largest in the country. Did I get that correct?
You did, yes.
Okay. And is what you're doing in this space with the Genomics Institute unique to you, or are other leading children's hospitals doing this as well?
Other folks are doing some of this, but I think what we're doing here is unique. And I think what we're doing here is unique on two fronts. One is in San Diego specifically, the Genomics Institute, it's not just a research ivory tower, if you will. It really is connected to clinical care.
Okay.
Right? The moment that a baby in our NICU is identified as a candidate for genome sequencing, that triggers orders and consents in Epic that then drive the lab process to extract a phenotype, a data phenotype of the patient in the EHR that then gets pushed over the genomics side to be combined with the outputs of the genetic data and to get contrasted with known attributes of specific genetic diseases to find diagnosis, right? It truly is integrated with day-to-day care. So it's not just a research entity, it's part of our caregiving process. And I think that is extremely unique.
That is the level of integration we want between research and care. And
Absolutely.
it sounds like you're accomplishing it. That's great. That's great.
Captain, our beloved service dog, is back for his third year at Vive and Hims. This Week Health is partnering with Alex's Lemonade Stand Foundation to raise $200,000 this year in 2025. It's easy to participate with this. Snap a photo with Captain, share it on social media, tag us, and for every smiling face in the picture, we'll donate $1 to support these families battling pediatric cancer. A huge thanks to our partners, Rackspace and SureTest, for making it possible. Join us and let's make a difference together. Visit thisweekhealth.com to learn more.
I want to switch gears from all of that and talk a little bit about you and your career journey. So you've been CIO at Rady for over 18 years. Is that right?
That's right. So it's like yesterday.
So tell us about your own career journey and what brought you to Rady.
Yeah, I think what brought me to Rady was ultimately, if I bottom line it, is having great mentors. I was lucky enough early on in my career to land in an interview serendipitously fresh out of grad school at Sarasota Memorial with Jim Turnbull at a time when they were the kind of pilot side for a product at the time called CareVision, which eventually became Sunrise Clinical Manager. And Jim just blew my mind. And I got lucky enough that I was selected for that fellowship and got to work with Jim during the fellowship. In addition to working with Jim, I worked with Mark Lazarus, who was the VP of Managed Care. And halfway through my fellowship, they both offered me a job. And that time I was young and naive, and I thought I was going back to Barcelona shortly thereafter. So I told them, you don't have to pay me for two jobs, but if you'll allow me, I'd like to do both jobs because I wanted to just learn as much as I could before I went back. And that got me to, at some point, Jim left to go to Denver Children's. He reached out to me to see if I'd be interested in a role there. I went to check it out. I worked with him for 5 years in Denver. And when I was ready to move to that next level, we had the kind of relationship where I could tell him is, listen, at which point do I need to start looking for a CIO job? And he told me, you're ready now. So when things come my way that I think might be a good fit, I'll pass them on to you. And sure enough, Rady Children's was one of those. I came in for the interview. I knew some of the other candidates. They were all established CIOs. I thought it was a practice interview, to be honest, because I had the chance. What I didn't know is that they were coming out of a very bad financial crisis first, followed by a safety crisis at the time. And I was probably the only candidate that they could afford. And so I got the job. And I've been very lucky to work here. It's a wonderful organization. 18 years and 3 CEOs later, I'm just happy to have been able to lead a very talented team that has allowed me to live up to my motto of better care through HIT. It's just an amazing place with amazing people.
I love it. And your story of how you got there, your mentors, and Jim, who I first met when I was on the Chime board way back when, but that he recognized in you, you're ready, and told you about opportunities elsewhere, I think is a very powerful story and something that we want to do for people and up and coming leaders. Obviously, if you've been there 18 years, you've proven yourself. That is a long tenure for a CIO. So that's awesome. Congratulations. So in terms of leadership style and approach, I'm assuming that you have to work with a strong partnership between your IT team, your IT leaders, and the operational teams. Can you give us some examples where that collaboration has been critical to solving major issues?
Man, there are so many. A couple years ago, we had our PICU, our pediatric intensive care unit, and our CVICU, the cardiovascular ICU. folks noticed that basically piece of equipment that connects a respirator to the patient. And what we were seeing is that they were getting more condensation than we had historically seen. I'm blessed by having an awesome team. My associate CIO, Josh Grummel, took the bull by the horns, working in parallel with in partnership with our associate chief nursing officer to get to the bottom of line. We've had tremendous partnership from our vendor who basically, on the one side, we worked on a kind of short-term solution for how do we fix that. But then our vendor decided that this called for a redesign of their qubit. And so they went back, went through the redesign, took it through the FDA process. And that's not a short process. And they're basically changing the product worldwide because of this finding to make it better. And we just learned that the qubits will be available for ordering in January. And tremendous partnership, not just with operations, but also with our vendors to figure out and identify the problem, figure out short-term solution, but then work on a long-term solution for real improvement, right? So that's one that comes to mind. Obviously, a couple others might be 2014. One of our physician leaders was interested in telemedicine, and we didn't want to add yet another telemedicine platform. So we reached out to Zoom, who we were using for video conferencing on the business side, and said, hey, have you considered being on the clinical side? And they really hadn't. So we reached out to Epic and did the first Zoom Epic integration. And for many years, we were really happy. I think Dr. Majid was doing 40 telemedicine visits a month. Then, of course, COVID hit. We went literally from one day to the next. We went from 40 visits a month to 1,000 visits a day across the enterprise. And that was kind of foresight. Maybe we were a little bit ahead of our times where we started it, but that forethought got us to be ready when it was really needed.
I'm curious, what's it dropped back to now?
We're about 10% of our volume. So I would say it's in the 100 to 150 a day.
Okay.
Maybe.
That's still pretty good.
Yeah.
That's good.
There are so many opportunities. We had, during the pandemic, our CEO got a call from the mayor asking if we would set up a health center at the San Diego Convention Center because we were going to be housing 3,000 minors who were separated from their parents at the border during the border crisis.
I remember hearing about this from you and maybe talking about it. Yes.
And that was, I think he got the call on a Monday. By Friday, we had set up an urgent care, primary care clinic, a lab, a pharmacy, a radiology unit that then we ended up dismantling because it wasn't really needed, all on Epic, all connected to the hospital. And that proved key because the city wanted us to test those patients for COVID every 3 days. Imagine trying to do that on paper. So yeah, there's so many things where, and obviously that was not IT led. Again, that was operations led, but strong collaboration with IT.
That's great. I want to switch gears again, talk about remote work. And while I have not read all the articles, I'm seeing a lot of headlines on some of the big companies, big tech companies, mandating everybody back in the office I think it's back in the office full time. You want to comment on that? I'd love to hear it, but you've embraced flexible workforce, remote work, apparently for quite some time. So how has that evolved post-pandemic, and how do you balance the remote and the on-site work for your IT teams?
Let me comment on the general trend first.
Okay, sure.
The cynic in me thinks kind of those mandates are an easy way to force labor reductions without having to deal with severances, et cetera. So that is a trend that we're seeing in companies that are trying to bolster their financial, particularly public companies traded.
Okay, that's an interesting perspective.
Having said that, I think there's tremendous gains of flexibility and productivity by allowing people to work remotely. I also think that maybe the pendulum had swung from one extreme to the other, and it was okay for a while, especially while you have kind of existing workforce members who are and have been part of the fabric of the organization. They live it, they breathe it, they understand the why behind the what, they're connected to the mission, right? They're part of the culture, but it gets harder as more and more of the workforce are new and remote and have never set foot in the organization, and they maybe don't have that connection. And so that makes it harder. I can't take credit as much as I love to take credit for remote work. Remote work in my team existed before I got here.
Really? More than
Yes,
18 years ago?
yes,
Wow.
our coders in health information management were remote prior to me getting here. We had some people in our applications teams that were remote. When I got here, we just grew that, obviously, because we grew the team. We're in the midst of major implementations with our Epic implementation, PeopleSoft, you name it. And when we had good people that needed to move due to family events, lots of military in San Diego, which means lots of spouses go to wherever their spouse is getting transferred to. We figured, why not? Let's keep them on site. And we saw, again, we didn't see drops in productivity. On the contrary, we saw improvements. People gain quality of life, not having to sit for an hour or sometimes two each way to get to work, right? And traffic and whatnot. All in all, we thought it was good. We've seen a couple of instances where it hasn't worked out. When those things happen, you identify it, right? You deal with it. But for the most part, it's worked really well. What we are realizing is that there are some functions that obviously need to be on site, right? It's hard to sometimes assess workflows if you're not familiar with the physical layout of a space or whatnot. And so I think ultimately one of the things that we realized is we've had a couple of instances where everybody on a given team, they were remote and it's fine. And remote in many cases being remote hybrid, right? They're remote, but they're local. If they need to come in, they can come in, etc. But in many cases, we have people in over 30 states right now, about
Oh, wow.
30%. Yeah,
30 states.
yeah, about 30% of my team is remote out of area, meaning not in the San Diego metro area. So it's either Northern Cal or out of state. In a couple of instances, we realized that kind of small teams where everybody was not local and it made those things hard. So now we're thinking about we need to find the right mix of it can still work remotely in many cases, but we want some local presence so that if somebody needs to come in, they can.
Yeah, great. One of my last questions is to talk about that ever elusive work life or life work balance, end of year, and thinking about the next year resolutions. How am I going to do things differently is maybe good timing. We know CIOs are in very high stress, high pressure environments. So, what do you do to take care of yourself and to encourage your team to take care of themselves?
I think early in my tenure here in San Diego, our CEO at the time, my boss, came in and told me, Albert, I want you out of the office before 5 o'clock, at least twice a week. And so I took that to heart and I got back into rugby, which is the sport that I used to play growing up. And I took up coaching, etc. So I love sports, and whether it's all men's rugby or getting out on my paddleboard or rowing or used to be running, but now it's more walking the dog. Or if anything else fails, I go to the gym. But that's good for me, kind of both mind and body. But I volunteer. I've served the rugby club's board. I've run the club for a number of years. I gave up that this last summer, once my son moved on to college. I'm a member of an angel investment group that basically helps me satisfy intellectual curiosity. And I meditate, not every day, but I do try to spend a little bit of time just being thoughtful, meditating. When my wife is not in the house, I play the guitar. Since we don't have basements here, I cannot go hide in the basement.
Are you telling me you didn't play that well, so you can't play
I'm
Lindsay
not
song?
that good. I'm not that good.
Okay.
I read, I write, I love to travel. I love to watch my son play rugby. I love to cook. Anyway, my teams know, I think it's a family first. If you don't take care of yourself, you can't take care of anybody else.
That's right.
So I encourage them to oxygenate the brain, to take time off. I think if you ask them, they'll tell you that I model what I preach and that I walk the talk. Some of it is I take the time and I take care of me and I expect them to do the same.
That's great. That's great. I think that's a great way to end, and that you walk the talk. So important. Thank you so much for your time today.
Thank you. It's been my pleasure. You always make me think.
Great. Thank you so much.
Thank you, Sue.
Thanks for listening to this week's keynote. If you found value, share it with a peer. It's a great chance to discuss and in some cases start a mentoring relationship. One way you can support the show is to subscribe and leave us a rating. Love it if you could do that. Thanks for listening. That's all for now.